Today we'll be looking into the unit 2 of learning outcome 2 of the structure and overview of the health and social care sector. We started yesterday, and today we're going to look into the aspect of the entire structure of the health and social care. And this
Please, what time did you do that of yesterday?
what time? I don't
Yeah,
understand your question.
you said you had it yesterday,
Yes, we did it, yeah. So
but we couldn't
Some of
take
us
part.
were not there.
That's why I wanted to.
That's why we are asking.
we had it yesterday. Those who are on the platform, yeah, we did it yesterday.
Yeah, what time was it, please?
You should have got a recording.
We don't even have it.
Yeah, we did it yesterday. Okay.
Please
Because
then
yesterday we
kindly
did
put it
English,
for us.
then we did math 9 and
We
10,
didn't hear
all
of.
that way to 11. So we didn't know the time we did that took place. That's why I'm asking.
Okay.
If you can get us the recording.
Yeah, you should check your model. The recording should be there. Okay.
And if anything, then the time shouldn't coincide with that of math and English.
I can't tell you. You need to check with the office. Okay.
Oh,
Or we can,
Okay.
if we have any question, we have to ask you because you did it. Please.
You need to
Just
check
have
with the
time on
office. We
us.
only lecture based. Okay. If you have any concerns, check with the office. Okay.
all right, we'll call the office
Yes, stay with
because
the
we are
office. Okay.
taking part in math, we are taking part in English. So if
Please,
anything, there shouldn't be any
I have other people on the platform. Okay, so I'm not sure of the schedulings and all that. So if you have any concerns, you check with the office that registered you. Okay. So we have understanding the health and social care provision for different ages and stages of life. You would also realize that in Unit 2, have you put the first, but have you put in your full first now you've not put in your full name on the platform? Hello?
Hello?
Faustina,
My
could
full
you put your
name
full
with,
name?
you said full name with email. Is there? Faustina Dazi. Full name.
Can you put your full name? Have you okay, that's fine.
I even have it twice there.
That's fine. If you've done it, that's fine. That's fine. And so we the we are going to look into how to outline the points at which the health and social care provisions may be required during a lifetime. And then we will also look into describe the health and social care services required and provided at different points during the lifetime. And then the 2.3 will look into to give a vivid explanation about the arrangement for long-term care provisions. And then the last bit, which is 2.4, is to explain how services are assessed at each provision point within the health and social care. As I explained yesterday, you have categories, you have pass marks, distinctions, and merit. And so, depending on how you present your submissions, when it's due to reply to your assignment, how detailed you are to asking the question will determine whether you're a pass mark student or a distinction student. And so to be able to attain a merit student, then you should be able to analyze the barriers to access to provisions at different stages, and also assess how the barriers are overcome. This in entirety helps in you achieving a distinction grade, or so to speak, a grade that involves merit or not. Okay, so these are just the components that we're going to do, but we have to look into the raw 2 slides as into what we're going to lecture today. These are just the units and the components that forms or a clear of an overview to each learning outcomes. Okay, so as I did mention yesterday, we were able to break down some key components within the health and social care. One of it was the Health and Safety Act 1974, and then the Health and Social Care 2012. We were able to look into what we call COSH, which is the control of substances as adults to health, and we're able to look into radar in terms of injuries that we need to report. I did mention that it's quite important we report all forms of injuries that comes along with our job, and whatever that is even about to occur, or what we call near misses. We need to make sure we have reported those informations into incident books and all that. And then we spoke about the Health and Safety Act, where employers are supposed to provide a serene environment free from any health hazards or safety hazards within the environment. And the employee also have a duty of care towards herself or towards complying with the health and safety environment that or health and safety appliances or environment that have been placed. So there's an health and safety book that you need to follow. We spoke about fire safety as well, where you're supposed to have some orientation relative to where you work as to when there's any fire outbreak. Then you need to know where to. Hello, could we mute ourselves, please?
Your microphone.
Could we mute ourselves, please? So that's me. Right. So today we look into the human lifespan varies from length and in terms of experiences from one individual to another. Some events were expected, but others seem to come out nowhere. A variety of factors that can affect individuals and their development, both positively and negatively. Okay. Hello, those of Olufemila Lola.
Oh, sorry, please.
Please. Okay. Now, the key stages in people's lives have particular relevance for their health. WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which is good. In determining the the well-being of a person is just to determine how physical sound and mental sound a person is, and not in the absence of disease or infirmity. Therefore, it focuses not only on reducing mobility, but also the impact of health determinants, economic, environmental, and social conditions on health and social cover in different stages. So we're looking to assess the entire stages of an individual in terms of their well-being. And hello. Olufode, do you want to go off the group? Then you finish, you join, okay? So this stages requires the stages of a person. There you look into a stage where you say, please, could you unmute yourself? Now, which involves your infancy stage, yeah, the early childhood phase. Then you have adolescence, you have early adulthood, and you have your later adulthood. Okay. Now, can you guys hear me?
Can hear you loud and clear.
Perfect. That's fine. Please, let's try to mute ourselves. Okay. And so which involves the early childhood, the adolescence, early adulthood, later adulthood, and then it forms the last part of the lifetime provisions of an individual. Okay. And it is important that we know this, because for every stage of a lifespan of for every stage of the lifespan of an individual, you need some kind of healthcare or a professional that needs to be assigned. So for instance, for infancy and child adulthood, obviously, during pregnancy and to the place of giving birth, a midwife is needed. A midwife professional is needed to help during those stage of the lifetime. And what do they do? Midwives, what do they are trained to support women during pregnancy, childbirth, and the early postnatal stage. Midwives are also responsible for delivering the information listed below to women and their families. So at the infancy or the early childhood stage, a professional who is needed to sort of help in those stages is the midwife. Okay. And also promoting the care of 0 to 2-year-olds. Okay, they examine and monitor the fetus well-being assessment, undertake screening tests, and keep records. They provide prenatal and psychological support for women and their families during childbirth, and they support families during pregnancy to prepare for parenthood. They also provide support in cases of bereavement, and yes, some for not to sound a bit sad, but for a mother who might, for whatever reasons, might lose a child during pregnancy, they are trained midwives. We call them the bereavement midwife or team. They are trained midwives who are able to support in those processes as well. And so these are some of the things. And the early childhood, we have health visitors. I mean, if you have a child and you have been discharged at home, you have all sorts of people who will be visiting you. One of them are social workers, but the other group of people, which we call health visitors. The health visitors, they normally come around and they work within the community, and what they do is they visit alongside school nurses, doctors, and they try to see if there are any support that the children may need. within the children's stage. So they don't stop visiting until the children are healthy or until they can really sign off the child and ensure that the child is very healthy and strong and there are no issues at all. Some of them come, they even check the weight of the child frequently, and then check if the child has immunization, everything is good to go and all that. So this, we call them health visitors, and they are assigned during the early childhood. The health visitor also helps for family support worker. The family support worker, they provide support for families with babies and children who have complex needs. Children who have complex needs, some of them may have learning disabilities, some of them may be sent, some may have some sort of autism and all that. And this support enhances parenting competences, adults' competence for work, as well as children's educational attendance. The family support worker also work with parents and carers of home or in groups. So the family support worker, their duty is to ensure that the family fiber, the support that the mother needs to support their children who may have complex needs or learning disability and all sorts of needs, they are there to support and to make sure that those needs are met. Okay. Then we have the family assessment team also. They also provide opportunity to get to know the whole family better. The assessment team it's also a part of a section of the profession which is formed within the family support team. But what they do, the assessment team, is just to make sure that they know the entire family unit, the individuals that form the family unit, and so they can give them all the necessary support that the family may need. Okay, so they help to decide the best type of support or service for the child and their family. In addition, there will be a discussion on the child and the child's health and development, how they are coping at the nursery and at the school. Okay, so they try to play the intermediary role from the family to your school places and all that. They visit the school and you see how the child is doing, so they can help you, the parents, as well. Okay, good. Like I said yesterday, if you have any questions, we can type it along the line, or you could sort of keep the questions, and when I'm done, we can discuss it, or you could raise your hands by clicking on the thumb up, that raising of hand thumb, that you can do that, and I can pick that up and answer the questions along the line. Okay. Now on the stage of adolescence, those are children and young people that progress through a number of transition stages in their lives and as part of the journey to adulthood. There are major transition points between 10 to 14 years, including moving from primary to secondary schools. This can also provide an opportunity to provide advice to support positive health choices and behavior. These are very strategic year group, because then the child then is progressing speedily, and the stage of 10 to 14 years is a critical stage, because the parents need to give more support to the child. That's the stage where the child is experiencing a lot of changes in the body and changes of opinions and decisions and all that. And they need to be a support to adolescents, school nurses, school social workers, community mental health team. They all have to. This is the stage that the child may have some kind of influences in the school, a bit of peer pressure and informations and all that. So one of it is substance misuse. Adolescent alcohol and substance use from age 15 have been associated with lower academic attainment, reduced school attendance, changes in behaviors, leading to impairment in relationships. Local authorities invest substance-related service provision, assess the different levels of need, the schools targeted provisions with groups vulnerable to drug use and specialize. All it means is that, or all it tries to establish is that during this 13 to 14 stage, it's a very critical stage where the council, the local council, identifies that parents need a lot of support during this stage, because these are the stages where children make certain bad choices if not mistaken, or care is not provided for them. And so the schools, nurses, the school works alongside with the parents, and every now and then they create a day or two where they can discuss with the parent and check the child's behavior at home. In fact, some schools do what we call, for those of you who are parents in the UK, you know, the school even arrange meetings on phone and all that between the social worker and sometimes the parent and the school together and see how best they can help children during adolescent stage, so that their right informations and right support are made available, where the students, the programs that the child does, where they attend, where programs, activities during the week, you know, library and all that. There's a bit of consistency between the school, the social worker, and the family. Okay. Do you have any questions at all? Now, the mental health and well-being. You know, as the child is progressing, the well-being and the mental health state of the person is very important. So adolescence is a critical period for young people. Now, the most recent data shows that 1 in 7 11 to 16 years old have diagnostic mental health disorder. Okay, so the adolescence age, as you are progressing beyond 14, it is important that there's a care looked into how they progress and if there's any support package. And so what they do, what they take, medication, is there any groups, any associations that the children are attending or form part to? Is there any gang or something? Because the mental health and well-being of the child during this adolescence is very, very critical and very, very important. So those social workers would want to know, are there community mental health teams? Have you identified something, any changes within the child that you have to report to the school or the social worker? Okay. Homelessness. Okay, becoming homeless can be a devastating emotional experience for a family. It may encompass feelings of loss, separation from friends and family, alienation from society, stigma, shame, and concerns about the future. Okay, so the council of social workers, and once any family decide or identifies that they are going to be homeless or about to become homeless, they will need to inform their social workers, so that because of the children that, and not the parent, because of the adolescent, the children that is involved, you have a duty as a parent not to hide nothing from your social workers or your support team. Okay, right? So they could see how best they can help you so you don't become homeless. Okay. Now, child obesity and physical activity. There's a huge obesity among the Black minority. Okay. There's high increase of obesity among the Black minority. And the health and social care professionals can play in supporting children with their weight, and pledges to provide them with the latest tools so they can help children, young and families with their weight. So they could help, so that if there are any activities that the child would have to attend, you know, those are very important. It helps in weight loss. They check the kind of food that the times that you eat the food. They are there to help and ensure that the obesity and stuffs are over monitored, and make sure that obesity and overweight is not something that will have some kind of situations and ailments within. It's very, very important. Okay. All right. You would also have to look into some of the outlined that points which definitely be required during a lifetime. You know, in the early adulthood is an extremely diverse period of life. It comprises a wide range of lifestyle choices and responsibilities. Some people launch directly into adulthood at legal age of 18, while others take a much more prolonged course. Change is always stressful, whether it is a good thing like marriage or having a child, or a bad thing like loss of relationship for a loved one. So in a period of life that is full of change, there may be many opportunities for challenges and stress. Now, what it seeks to explain is that because in early adulthood is an extreme diverse period of life, It comprises a wide range of lifestyle choices and responsibilities. Some people launch directly into adulthood at the legal age of 18, while others take a much more prolonged course. During this period, there are huge changes in the lifestyle of a youth or of an adolescent. Huge. They are managing themselves as an adolescent. They have school issues that they have to deal with. So it is important that a parent work together with the social services or social workers and their schools to make sure that these changes are properly managed. The adolescent should be able to open up to the parents so that if there are any issues that needs dealing with, it is properly dealt with as a family unit, and also working with the social workers and the council or the health support workers. Okay. They may be difficult in coping with emotions such as anger, sadness, anxiety, alcohol and drug abuse, academic or employment difficulties. Okay, a child may have difficulty of securing some sort of or the parent may have some employment issues that may affect the way they support the children, or the parent may be a single parent who has no partner around it and it's quite difficult. You need to be able to open up so that they can support the family. Your parental issues, okay, marital issue, difficulty in finding a romantic partner, financial stress, spiritual issues, okay. All these are things that a mother or a father who might be a single person should be able to open up and see how best they can be helped. Treatment can help in these problems and find ways to cope and work through this issue to increase success. A broad range of specialized or specialties that can help, including psychiatrists, psychologists, and licensed therapists. Okay, it tells you that there are opportunities available in the UK for specialized people to help in your situation. If a parent find themselves in any issues that is difficult for them and is above them, and their children are going through, they're becoming stressful for the parent, there are opportunities that you have to open up and they can help in dealing with those issues. Okay. Okay, late adulthood. This stage is considered to be the late from time where which are mid-16s until death, because we are living longer. The date that late adulthood is getting longer. A 10-year-old child today has a 50% chance of living up to 104. Okay, it talks about our mortality rates, our death, where people there's health. The reasons to state that people are growing older than before, and therefore, the expectancy of a child about 50% talks about 104. People are living long during that stage. But then what are the support needs? There are a variety of charities that help set up support services such as Age UK. Age UK helps older people when they are growing old in support psychologists, the advice and support that they give to old people who are getting aging. Okay. Home help, handy person services, food care, transport, dementia support, those who have dementia, liability, and then learning disability and certain kind of situation. There are various groups that help. Okay, the NHS also provide access to a variety of services such as the social care workers, community nurses, and GPs, dental, hearing, and optical care homes, and carers where required. Where it is important, where per assessment or diagnostic assessment has been made on an individual, and they feel that the individual may need some carers to support them at their home, it will be provided to help. So there's no reason why a family should hide anything. If they are going through any difficulty in taking care of their children, they should be able to open up, and there are supports available to help in that regard. Okay. Now, there are other services that are required and provided at different stages and points in a person's life, such as the maternity services. Okay. They are here to help women through their pregnancy journey to ensure that the health needs of mothers to be met, from pregnancy tests, routine checks to delivery services. Okay, so and maternity services are available during those pre-pregnancy stage and all that. Then the child care also, family support can include helping looking after your child, such as daycare services, help with parenting, such as parenting classes, courses for family support workers, practical home help, access to children's centers, support services may also be provided. In other words, there's no excuse where you need to hide anything that you are going through as a parent or anything that your children may be going through, which you are aware of, and you need to open up because there are so many childcare services. There could be childcare services in terms of monitoring from the government, and there are childcare services in terms of co-parenting, helping you become active and your children become active in terms of classes, musical classes, and different interventions that are available to help families and their children. Okay. And then we also have what we call the CAMS, the mental health, such as the CAMS stands for child and adolescent mental health services. If the child is experiencing some kind of autism and mental health challenges, it's a free service run by your local NHS. It is made up of medical and mental health professionals. This type of care is known as home care or domiciliary care, which we all know of. Domiciliary care, I said, is a kind of care that is provided in the home. When people come to your home to take care of you and your children, okay? It's called domiciliary care. And this home help also support with cost of medication, help maintain and cope with long-term medical conditions. So when people visit your homes, if you have any issues, they help with your errands, they help maybe cleaning of your homes, they help with your medication and call out and your GP arrangement and all that. These are very key things that we need to understand. And it also depends on the person's ability and the level of care and support they receive. Children and young people with a learning disability may also have a special educational which is called SEN. Yes, SEN is a special educational needs that the schools provide. If the child have any autism and learning disability or some learning impairments, they classify your child under that. And so there's a special tutors who have special training to take care of your child and help them in their learning disability issues and make sure any Down syndrome, and there is much support within the schools. People have been trained to be able to help and communicate with your child and understand them and all that. So there's no excuse where you should add anything from your social worker or open up to your support worker who visit your home to sort of help you in your situations. Okay. Okay. Then we have end of life care. End of life care is one of the care that is provided for people who have been declared that they were about to die. Okay, so normally in the hospital, if you visit the hospital, you normally see normally a person who has been declared to die, you see their family people around and coming for prepare their final rites and whatever. And so end of care life is a kind of it's a support kind of care where people who have made their wishes and they have been declared that they are going to die maybe in a 1 week time or in 2 days time, 3 days time. It is important that there's a special kind of care that is given unto them. Okay. Also, he says the end of refers to a care for a person needing to end of life or in advanced stage of terminal ailment. Generally speaking, people who are dying and need care in four areas: physical comfort, mental health, emotional needs, spiritual needs. So normally you see for those of them who are Christian, if they are Muslims, you would see their imam or from the mosque coming to do final rituals for them. If they are Christian, you see the priest around doing final. They need that physical and emotional soundness because they are about to pass away, and it's what we call end of life care. Okay, ending the life of the person, and that life need to be managed, and you normally see them in the hospitals and all that. Okay, we also have services include GP. GP are services that you can count on in terms of any issues that confronts you, and your first point of contact is your GP. Okay, we also have we call the preventive health care. This deals with the prevention of illness to decrease the burden of diseases and associated risk factors. You know, when there were outbreaks of COVID-19 and all that, there are preventive team that may be visiting or call from the GP and may prevent any further outbreaks and sending you toolkits, COVID-19 toolkits that you can use to check yourself so that you can tell whether you have a COVID-19 ailment to prevent it from, or the flu jab. The flu jab are given or injection that you can take to sort of prevent any flus that you get in future. But these days, even when you take the flu jab, and the flu still attacks you, you don't know it attacks you, and it doesn't prevent it as well. And then you have the hospital, social care, and mental health services that I've mentioned as well. What then is a long-term care? A long-term care is also known as a social care, which may be required when individuals become ill or suffer disability. That means they are unable to care for themselves, with the probability that the disability will continue for a longer term. Okay, so a longer term of ailment involves an ailment where it restricts you, and for a long time you are not able to do something because the ailment has taken a very greater part of your life, and this is what we call long term. Okay, it's an ailment that causes you to um remain unwell for quite a long time, and the long-term provision for individual with long-term health condition disability. Long-term care can also refer to a broad range of medical and social services options that are available to meet the needs and compensate for the functional disabilities of persons of any age. But this care most commonly serves the elderly who can no longer function independently. Okay. Care in the community. There's massive care in the community. It's a strategic vision described as a healthier future and the objective set out in the Department of Public Service Agreement. I mentioned yesterday Department of Public Health, or the Public Health, which comes under the Health and Social Care Act 2012. Okay, the key aim is to support an increasing number of people to live independent life, preferably in their own home. I didn't mention what we call domestic care, and I mentioned what we call supported living. In social care is looking at more of person-centered care, okay, where funding is given to people to stay in their homes so they can live independently and they need minimal support in their homes. And that is why a carer needs to be trained and sent to help the person, okay? To do this, the ATHE in health and social care needs to be developed effectively alternative to hospital care, which are designed to reduce inappropriate admissions and unnecessary lengths of stay. There are also needs to be strong focus on rehabilitation in tandem with assessment of long-term care needs to avoid unnecessary reliance on residential and nursing care home. There also needs to be a strong focus on rehabilitation in tandem with assessment of long-term care needs to avoid unnecessary reliance. In other words, the health and social care sector within the Department of Public Service has been rearranged in a way that they want to shift a more reliance and over-reliance on care homes and residential homes to helping people in their homes, so that there is no massive reliance, or massive over-reliance on the care homes, and where everybody is being sent to the care home or residential home. People can also stay in their homes and they can be given the necessary care that they need. Domestic care is the range of services put in place to support an individual in their own home, provided to those that require additional support, day-to-day household tasks, personal care, and other. I've explained this about. I said domestic care involves people staying in their home and carers are being sent from agencies or from the council, and their duties to help the person to sort of live independently. And so they help them with their personal care, they help manage their medication. And for you to be able to manage medication, you need to be medication trained, what we call medication training. Okay, you need to have a level 1 or level 2 medication training, or medication administration. You don't administer controlled drugs because you are not a nurse, but you can administer uncontrolled drugs like what? Paracetamol, aspirin, and all those things. You can administer them. But when you administer, you need to write into what we call MAR, okay, medication administration report book. You need to report the dosage. If it's 3 times 4, or 4 times 3, it tells you that medication need to be given 3 times every day. And so when you give medication 3 times every day, once you are trained, you need to recall them. Okay. So not everyone can give medication, only when you have been trained by your company to be able to do medication. If you are not trained and you give medication, there's any problem, you can be held liable. Okay. You can lead to prosecution, you can go to prison when you have not been trained. So do not do medication in your workplaces if you have not been trained. If any manager tells you to give medication and you have not been trained, you tell your manager, I have not been trained and therefore I cannot administer medication. All right. Now, helping to mobilize in and out around the home, household tasks and meal preparations, clinical care, including catheter. Catheter is the urine bag that if you go to the hospital or sometimes they home, they attach them at the leg of the person. You have connected to the private part of the person, whether a man or a woman, so that they can pass on urine through that bag. Okay, normally after operation and they want to monitor the urine flow or the watery flow, or that's what we call catheter, or stomach management or peg feeding. Stomach management is the physics that comes from us. Okay, yes, the bag that is attached that the physics go through is what we call stomach management. Peg feeding also, those are specialized where they put something on your leg. It's called peg feeding. Okay, sometimes it goes through your nostrils. Water that comes from the nose around to the back. It's called peg feeding, and you cannot do this thing if you have not been trained. Okay, right. Institutional care. Okay, institutional care is the most common form of long-term care. Elderly and disabled people are able to interact together while having 24-hour care to daily necessities by professional. This provides patients with a sense of security. Institutional care is also a type of residential care for large group of children. It is characterized by a one-size-fits-all approach according to which the same service is provided to all children, irrespective of their age, gender, abilities, needs, and reasons for separation from parents. Institutional care, therefore, is usually provided by a large organization that is mostly comprised of nurse practitioners, doctors, therapists, utilities, and many more. Okay, so it's a common form of long-term care, where the elderly and disabled are able to interact together with also having 24-hour care. Now, 24-hour care is round the clock from morning till evening to the next day. Because of the complex nature of an elderly person or an adolescent, it is important by risk assessment done by the social worker in your home. And if the child or a parent, an elderly person who is ill, there must be a 24-hour care. It means that from morning till evening, there must be a carer at every time. Okay, very, very important. Okay, now within the UK, access to services throughout its provision is done through the following. Access to service agent, we call direct contact made by itself, agent, dentists, opticians, through GP or referrals. The doctors have the right to refer through your GP, through private insurance provider, okay, through social services or through educational. Yes, you may have a call from your school and say, look, we have identified that your child is going through something, your child is having some issues, and therefore we are letting you know as a parent so you can make a referral. Okay, the GP can assess you and also do referrals. And school establishments, okay, various organizations, the NHS itself, you might go to an A&E and they would have identified something about you or your child and they made a referral. Okay, what are the barriers in accessing services? There are factors that prevent an individual gaining access to health and social care. Yes, of course. Some of these barriers may be ailment, barriers to services, regional, social, economic, and policy barriers. Okay, regional barriers are individuals that live near health, social care, early years services, and others may live some distance away. Okay, people may have certain sickness due to stigma, may live very far from health facilities. Okay, so for those individuals who do not live near the services may find that their buses in the area do not run at a convenient time to an appointment. Of course, if you live proximity to a bus stop, if you live in a place that does not have regular bus stop running, it may affect you because you may end up becoming late to your appointments, or you may not have buses running regularly. Therefore, you are not able to regularly meet certain GP appointments and all that. So this affects our healthcare provision provider given to you. Okay, or you may live in a place where reception is very bad, that whenever you are talking to someone, they can't hear you. A patient may need to have specialized treatment, which may be many miles away and find it difficult to get there. Find it difficult to travel to a service because of distance is a geographical error. Okay. Yes, when the distance is very far, or you struggle, or you have to travel very far before you reach the nearest hospital, it's what we call geographical barrier. It's also a barrier. Okay. Some individuals may find it difficult due to their mobility problem. They cannot walk a distance in health and social care in many years. Okay, for those who may have certain ailments, they are not able to walk because of their health condition, and it's also a part of barrier. Okay, it's a barrier. Okay, it's maybe isolation barrier, or there may be even depth barriers as well. Okay, psychological barriers. These barriers affect the way an individual thinks about service. Aging, it may be that they have a fear of a dentist, okay, or if an individual feels unwell, but they are worried about finding what is wrong, and they may not seek help from their GP. Yes, psychological. You have ailment, but then you find it difficult to open up because you are quite scared, or you think it's a stigma. HIV is, and you think you have, and so you are quite psychological barriers. Okay, financial barriers. Okay, and this is debt barriers. This is to do with how much it might cost to access a service. If the health, social care, or early years service the individual is trying to access in some distance away, they may not be able to afford the transport cost to get there. If a patient has to pay for medical prescription, they may not be able to afford it, and so they do not get medical they need. These are financial barriers, because after you have been to your GP, and then you are not entitled for free medication, you have to pay for it. And so not everybody have the money to even pay for their medication. It may be huge, it may cost 30 pounds, 40 pounds, and they may not have money to pay. And these are barriers as well. These are what we call financial barriers or debt barriers. And then under economic, you can look into what we call resource barriers. Okay, resource barriers. Sometimes within the health and social care early years service, an individual needs to access may not be available due to staff shortages or lack of money for the service. Yes, of course. I explained yesterday that A&E, if you look at the A&E structure in the UK, many a times you may be very, very, very ill, but you go to A&E and you have to sit there for a long time before you are called or attended to. Okay, and it's very only because they don't have a lot of staffs available to attend to you, and this is what we call resource barrier, and it's not the best as well. Okay, you may have what we call policy barriers. Okay, under policy barriers, you are looking at several policy barriers that need to overcome if integrated care systems are not established. Okay, more widely, policymakers should explicitly recognize the need for competition in some areas of care and collaboration on others, and should develop competition rules accordingly. Okay, so several policy barriers need to overcome if integrated care systems are not established widely. And so, in other words, there may be policies that may not necessarily serve the purposes of healthcare provision, and those policies need to be looked into and reviewed. And so policy barriers may not necessarily favor the essence of healthcare provision that is given to a certain group of people within the stage of healthcare, and therefore it needs to be reviewed. For instance, if there's a policy that you need to have a referral from your GP before, or if there's a policy that you need to go to A&E when you are very sick, and when there's no persons around, you need to wait for it. Needs to be looked into, because if the policy says that you need to be assessed before you are taken care of, there should be a faster way of assessing people, okay, within the A&E, so that people don't sit there for a long time. Okay, and what may be the policies, the various ways of overcoming those or addressing those barriers. Okay, for example, for regional barriers, there should be regular transport provided, house visits or pop-up clinics for people who live in the areas that buses don't run regularly, or they run once every 1 hour or every 30 minutes. There should be a complaint to the MPs or the local authorities so that the transport links are increased in that area, or new transport schemes are introduced in the area to help. So there could be also house visits for people who are older people who are elderly and cannot go to GPs and all that. There could be house visits. Nurses can visit them and take care of them rather than they have to travel to clinic or hospital. Social to overcome to introduce a body system where patients can access services with a trusted person and explain steps or procedures. Okay, there could be a system in place where patient can access those services. It could be just within the locality and not a distance so far. You don't have to travel very far, but you can have some community nurses or nurses around, or a place where it's created to serve the community rather than you have to travel very far. And resources, and to distribute resources, vaccinations on needs. I mean, COVID-19 and 2 cases can be posted, flu jabs can be posted as our various homes that people can access themselves and able to sort of rely on those things by themselves in their home. Okay, policy. How can you overcome policy to adapt policies to reflect current needs and requirement? Adopt. So, in other words, there may be policies that have been done for maybe years upon years and it's not been reviewed. Because economic wise, GDP growth, people grow, because if 2 years ago a country was 16 million, maybe in recent times the country is about 80 million, and therefore the increase of number of people within a country overcome the number of healthcare provisions available, and there's a need to look at those policies to review them to make sure that they are meeting the current needs of a country or the current needs of the healthcare provision that has been made available for that particular a country. And so you may have at model policy that is not serving the needs, but the current needs of people are quite different. There are diverse needs of people, that needs to be met. And so there's a review that needs to be done to look at the current health and social care policies that is available. Okay, because people are growing, older generation there are more older people who are sick than they are young people, and so they have to be reviewed into how best these older people can be looked into, because some of these older people cannot move around, cannot travel around, and so what policies can be made or adapted so that people can be visited in their homes and supported rather than they have to travel to hospitals and all that. Okay, all right. And so we bring our lectures for today to an end, and we'll be able to look into the points at which health and social care provision may be required during a lifetime. We'll be able to look into the health and social care services required and provided at different points during a lifetime. We'll be able to look at our various arrangements for long-term care provision. We've been able to look into how services are assessed at each provisions point in your chosen country, for that matter, the UK. We'll be able to look into the barriers to access provisions at different stages of your life. Okay, and then how do we overcome those barriers? Okay, we spoke about various barriers. We spoke about resource barriers, policy barriers. Okay, and all that, and we'll be able to look into how we can overcome those barriers and how those barriers can be addressed so that they can meet the specific needs of a country or its people. Okay, this is what will bring our meeting. Do we have any questions at all? Do you have any questions at all? Is there any questions, please? Hello?
I don't have any question.
Do others have any questions? Faustina, are you there? Faustina,
Yes,
are you
I'm
there?
here. I'm here.
Do you have any questions? Faustina, I just checked the WhatsApp group, and I realized that yesterday you asked of the link and it was sent to you. So why didn't you join?
No, it was.
It was sent. It was. I sent them to you. Thank. It was on the group. I've seen it. Even your colleagues also send a group on the same group. So why didn't you join? The level 3 group. Health and social care. I was the one who sent it to you. Anyway, do we have any questions at all, please?
No.
For
We
me,
don't.
no, I don't have to. No.
You don't. Is Emmanuel on?
Yeah, Emmanuel.
Emmanuel Abu, you are in. Okay, that's fine.
Yeah.
Dominola, are you on today?
Yes.
Okay, I've not heard your voice today.
Oh, I'm sorry about that.
Good. Say,
Good
are we
afternoon.
okay? Victor, are we okay?
Yes,
Oh,
I'm okay.
there's a question I want to ask.
No.
Okay,
My
ask the
question
question
is
then.
that due to this unit 1, we just finished unit 1, isn't it?
We are still on unit
That's
1.
unit 2.
Are we there? Are we together?
Yes. I
We
want
did
to
let
ask that
we
we
did
did
learning
unit,
outcome 1 yesterday, and today is 2.
yes. Yeah, today is 2. I want to ask that can we start the assessment on unit 1? And
The
can we start it at
assignment.
any time?
Is it the
Yes.
assignment you're talking about?
Yes.
Yes, you can. You can start doing the assignment. Yes. If you look at your model, you would have seen the assignments brief. You have them, don't you?
Yes. That's the one I'm asking. I've started it
Yes.
already.
Yes. So I explained that yesterday, I think. Were you not
Yes.
part of it?
I'm part of the class. I want to know maybe you can submit at any time or ahead.
No, you cannot submit until we finish all the full units.
All the full units, is it all the full units of unit 1 or the whole
No,
class
we
on lecture?
have 2 more units to go. Have you not checked?
Yes.
Yes, so until we finish, the last assignment will be, I have to have what we call assignment discussion with you guys.
Okay.
When I've done that, that is when you have 2 weeks from that period to submit your full assignments.
Okay. But today's
But you
class
can
is
start
unit
it.
2.
Say it again. Say it
I mean,
again.
today's lecture,
Yes.
is it unit 2 or is
Yes,
it still
that's
under the
learn
same unit 1?
LO2. Yes, that's LO2. Yes.
Okay. Okay. Thank you.
Please, mine is not a question, but a
Okay.
concern to raise.
A concern. Okay, go ahead.
Yeah, because some of us are doing the English, math, and then this one. So if they are run concurrently at the same time, it may affect some of us. So maybe next time when the schedules are made, they try and then consider us,
Okay.
please.
Okay. Thank you. Faustina, I did advise you that I'm just a lecturer, okay? I don't do the scheduling. Do you understand me?
Yeah.
So you raise this concern through the departments that did the registration for you, okay?
Okay.
Yes. So those who you should have known, who do you communicate with? You have somebody that you communicate with that registered you, isn't it? Or call the office tomorrow, all right?
So if we call, won't it be like reporting,
You are
making
not
a report?
reporting nothing. No, you are not
All
reporting.
right.
Okay?
Okay.
They scheduled
Okay.
you. I don't know. I don't know you. First now, listen, I'm just a lecturer. I don't even know whether you have maths or English and all that. You understand me?
Yeah.
I don't know anything about you. So you need to pick out with the office. I'm just a lecturer who have been assigned students to lecture them. Do you understand me?
Yeah.
Yes, I don't know anything about number of courses that you are doing. I don't know whether you are doing English, maths, and all that. I have no idea of. So what you need to do, but I can't remember that yesterday you asked of the link, okay, of the class, and you are in the group. You are on the group. You are on the level 3 group. Have you not realized?
I know,
Yes,
but
and the
the
link was
time
sent to
when I
you.
requested for the link, it was
Yes,
at the same time I was doing the English.
exactly. So that is not
Yeah.
So you're supposed to
So I
join.
didn't know which one to join.
Okay, so raise
And
that with the
the
office,
English
okay?
one was saying we will be writing exam. So I wanted to ask him some questions.
Okay, so like I advised you, call the office tomorrow, send an email, and ask how they can help you on that matter, okay?
All right.
Because you should be receiving your scheduling for every. I'm sure you know your next lectures for level 3. You should know. Everybody has
Yes, I know.
emails. No, you should
Yeah.
have.
I
Guys,
have it.
don't you have your next lecture date?
We have it. I have it
Yes, we
for
do.
next week.
Yeah, so Faustina, by now you know. You understand me? So if you know it's going
Yeah.
to coincide with your maths or English or whatever, you should draw the attention of the office. Okay?
All right.
Do you understand me?
Yes, I do.
and not wait till when and you have your concerns
No,
that
in fact,
yeah.
I did not see the notice until I saw it yesterday when we were having the lecture.
Okay, then
Then
be
I
checking your model.
realized they were coinciding.
Okay, so I advise you check you because everyone would have gotten those notices. So go back, check, and make sure that it's not if it's concerning, then you can draw the office and see. But for every lecture, there are recordings that will be made available as well.
But what of the time they give you, you have other things doing. So you do this, you go back, do something else, do that. Maybe you go to work, you are not even allowed to take a phone
Hence,
or take something to. So, and how do you get the lost minutes or times?
how do you do what, please?
How do you replace the lost times?
How do you replay the loss? That's why you have recordings. You
Recorded
listen to the
video.
recordings. Okay.
Okay, then if the recording can be sent to those who
Check
lost
your
it
model.
yesterday.
The recordings are sent to your model, so check your models. Okay.
Okay.
The office
Can I
works
say
on that.
something, please? It's getting too long.
All right. Is there any
Can I say
questions
something?
again, please?
Yeah, sorry. Can I add something, please?
Yeah. Who is speaking? Please? Is it Sayi?
This is Ayodeji, please.
Okay. Go ahead.
I just wanted to add to the other lady the other time when she made mention of the units about the assignment and all that. Just to point you into it, this is unit 1.
Yes.
Unit 1. Yeah, this is
Yes.
I just wanted her to know this is unit 1, but the lecture is LO2. So we're actually treating unit 1. So I just wanted to mention that so that everybody understands that we're on unit 2.
You are right. You are right. 100%. Yes. So unit 1 has different learning outcomes. You have
Yes.
you have LO1, you have LO2, you have LO3. So if you look at the first screen I shared, for those of you before I started lectures, I had the let me go back again. Let me explain it. 1 minute. Let me do this. Can you guys see the screen?
Yeah.
Can you see? Have you seen?
Yes.
So now we did unit 1 yesterday, didn't we?
Yes.
Can you see the screen?
Yes.
Now unit 1, if you look at it, let me highlight this. Can you see where I've highlighted? You see where it ends? As it has 4 components. Can you see that?
Yes.
So unit 1 has 4 components. That's 4, 1.1, 1.2, 1.3, 1.4. This is what we did yesterday.
Yes.
Are we together?
Yes.
Then so today we started unit 2. Am I right?
Yeah.
Are we together?
Yes.
So now that's unit 2. Unit 2 also have 4 components. 2.1. The question 2.1 is outline the points at which health and social care provisions may be required during their lifetime. 2.2 describe the health and social care services required and provided at different points during the lifetime. We spoke about all this. 2.3 explain the arrangement for long-term care provision. I spoke about the long-term provision where I says people can have ailments for long term that may affect them. Okay. And then lastly, we have 2.4, which is explain how the services are accessed at each point, at each provision in your. So that's 2.2. 2.4 we finish. The next lecture we are going to have is 3. Are we together? And 4.
Yeah.
So we have 2 more lectures to go. And that's I've just highlighted them. Can we see now?
Yeah.
We have 3 and 4. Those are 2 lectures here. And so when we finish this,
Is all this under unit 2 or what?
no.
It's 1.
Unit, are we together?
Yeah.
See,
Unit
all
1.
under
Okay,
unit 1,
structure and
under this,
overview of.
under
Okay.
this. Are we
Okay.
together?
Yes.
Yeah.
Aha. All under one under unit. Do you get me?
Yes.
Yeah.
Good. Are we getting understanding, please?
Yes,
Yeah.
it is.
So we have 2 more lectures to go. We have 3 and 4 to go. And the last bit will be assignment discussion. So nothing stops you from starting your assignment. However, for submission, you have to wait till we've completed everything. Do you agree with? Do you understand me?
Yes.
You have 2 weeks from the time we've completed all the topics. Okay. And then we've done assignment discussion, and that is when I say assignment discussion, I'm going to take you through, see, this one. I'm going to take through all what we expect of you in terms of the font size, your references, and all that. This is what I'm talking about. I'm going to take you through all this thing, okay? Before that, you can do your submissions. But nothing stops you from starting the assignment, okay? Are we together? Team, are we together?
Yes,
Hello?
we're together.
Yes, yes, we are with you.
Yes, we are.
Feel free and ask all the questions, please. Feel free and ask all the questions. So, for instance, let's look at one. This is indicative content. Let's look at one, which we have we've had a lecture on already. It says, understand the structure of health and social care in your chosen country. It says the aims and health of a social care: promote health and well-being, keep people healthy. Organizational sector, national, regional, size of, we've spoken about all this: funding of health and social care, state funding, private health insurance, clarity, health and social care, and all that. These are things that we've discussed already. Okay, we've had a discussion about this already. Now, see, if you look at one, I spoke about merit and distinction, and I explained that for you to be able to get merit, you should be able to outline how the sector is regulated in your chosen country, for that matter, the UK. To be able to attain distinction, you should be able to analyze the health and social care spending for your chosen country. So having identified the sector in your country, you have to also look into the spending, okay, of your chosen country, how you can analyze the health and social care spending for your chosen country. Are the government spending, are they meeting up expectations or not? You should be able to analyze it. So the words that will enable you to get a distinction. If you decide to remain at merit and you don't talk about this, then you can only get a merit. If you don't want only merit, you want to get a pass, then yeah. But once you see the word explain, it means that you have to go deep. The word explain means you have to go deep about how you go about in answering the question. When you say describe, it has a different meaning from explain. So these are some of the things that I have to throw more light on in answering your questions. Anytime you see the word explain, it means that you have to be more detailed in your answer. And they say describe is not like explain, okay? Describe is a bit more non-detailed, describing of something, okay? But in explanation, you should be able to be more detailed. Don't forget that for every explanation and description, you need to have some references, okay? You need to state reference. Where is your source of information? Okay, if you are quoting from the Department of Health and Social Care or the Health and Social Act 2012, you must state that this information is coming from the Health and 2012. And in your assignment, the bottom part of it, you have to have your reference list. Are we together? You need to have your reference list. Other than that, you'll be cited for plagiarism. Okay?
Okay.
Are we together?
Yes, we are.
Okay, first, are we together?
Yes, I'm with you.
Good. And so assignment can be started. Yes, your student model, you might have all this information on your student model. Assignment brief, everything should be on. Okay, it should be on. However, in terms of the submission, you have to wait till we've completed all the 4 or 5 units. And then you have 2 weeks from that period of you completing everything to submit your assignment. Okay?
Okay.
All right. Guys, any more questions?
Please, can I ask a question, please?
Please go ahead.
Okay, my name is Noel, and I'm asking in respect of the submission of this assignment.
Okay.
Because from the schedule, I can see our last lecture taking place on 29th of March.
Okay.
And like you said after the last lecture, we'll now have discussion of assignment.
Yes.
So considering the timeline between last lecture, 29th of March, and when we'll have the assignment discussion with the upcoming graduation, I'm trying to consider, because I last spoke to the office and
I know
said,
there's a graduation on 24th of April.
Yes. So I'm
And
trying
so-
to marry the timeline, because they say our set is also involved in the graduation, to know if there will be another module coming in after this first module that we are doing.
I reckon if 29th is the last lecture, as you mentioned, that lecture does it state assignment discussion?
No, that's the last lecture from the module, completion
I
of
think
the
they will
first module.
arrange. I think they would send that discussion as well far before 29. I'll speak to the office, the back office tomorrow. Okay, I think you're supposed to have another arranged lecture for that assignment discussion just after the last 29th. Okay.
Okay.
Yes, I'll speak to them.
Okay.
I think they've not arranged that yet, but there's supposed to be an assignment discussion for every lecturer. There's always a stage for assignment discussion, and so that should follow up straight away from the 29th. I will speak to the back office so they can send that to you in time. Okay.
Okay.
All right. But then I know 24th April is your graduation. That I know.
Okay.
All right. Guys, okay, go ahead.
So if you are not able to send your assignment, whatever, will you be graduated?
I don't think so. I don't think so. Because then you have to join next batch. I don't think so. Because you need to be duly assessed so you could be given certification. Okay. So if you're
So
not
what
part
if
of
you
those who have successfully passed and they've assessed and they have been
so
cleared for
what if you send your assignment a day to graduation? What happens?
I don't think they will still classify you under that. I don't think it allows you to graduate. You need to submit in reasonable time far before 29th, 24th of April. And so the office will know those who are due to graduate or not. Sometimes the office allows you to join the graduation group, but then you might not have your certification, sometimes not. So have a word with the office, the back office, okay? Call them and discuss those with them, and they would give you a better, more answer, okay?
Are we writing any exam?
Your exam is your submissions.
Just the submissions.
Yes, you don't write any exams.
Okay.
Okay. Guys, any more questions, please? Any more questions, please? Okay. Lovely. Have a lovely Sunday then, since there's no more questions. It's lovely to be part of the team, to be your lecturer for today. I'm most grateful. Feel free, if you have any message, you can send them on the group, or you can call the office if it's something beyond me. Anything administratively is beyond me. So speak to the office and they will address that. If you have any double lectures that is considered, speak to the office and they'll arrange that for you, okay? All right.
All right. Thank you so much.
All right, Gams. I'm so grateful, guys.
Thank you. Bye.
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 See you. Bye. Bye.
Yesterday's recordings, please.
Yesterday recording. Yeah, check your model. The office will send that to you.
Okay. All right.
Yeah, check the office. Okay, I recorded it, so it automatically goes to the office, and they normally upload on the YouTube or send it to your student model. Okay.
I will check the model. Thank you.
Okay. Thank you, guys. Take care.